Not even the surest surgeon's hand is quite as steady and consistent as a robotic arm built of metal and plastic programmed to perform the same motions over and over. So, could it handle the slippery stuff of soft tissues during a surgery? A team including a Johns Hopkins University computer scientist just published research showing that a robot surgeon can indeed adjust to the subtle movement and deformation of soft tissue to execute precise and consistent suturing. The research promises to improve results for patients and make the best surgical techniques more widely available. Limited robotic automation is already used in surgeries involving rigid structures such as bones, which are much easier to hold still during the procedure. Soft tissue can move and change shape in complex ways as stitching goes on, requiring a surgeon's skill to respond to these changes to keep suturing as tightly and evenly as possible. According to the researchers, more than 44.5 million soft tissue surgeries are performed in the United States each year. The published results involved suturing two structures. This procedure, called anastomosis, meaning joining two tubular structures such as blood vessels, is performed over 1 million times a year in the United States. According to the researchers, complications such as leakage along the seams occur nearly 20% of the time in colorectal surgery and 25 to 30% of the time in abdominal surgery. Robotic soft tissue surgery promises substantial benefits through improved safety from reduction of human errors and increased efficiency due to procedure time reduction. This surgery, however, could present a challenge in that it can be tricky for a robot to adjust to the soft tissue's slips and screws during suturing. To perform the experiment, the researchers developed a robotic surgical system called the Smart Tissue Automation Robot STAR. It features a 3D imaging system and a near-infrared sensor to spot fluorescent markers along the edges of the tissue to keep the robotic suture needle on track. Unlike most other robot-assisted surgical systems, it operates under the surgeon's supervision but without hands-on guidance. The STAR robotic sutures were compared with the work of 5 surgeons completing the same procedure using 3 methods: open surgery, laparoscopic, and robot-assisted surgery. Researchers compared consistency of suture spacing, pressure at which the seam leaked, mistakes that required removing the needle from the tissue or restarting the robot, and completion time. The robot's time was longer than open and robot-assisted surgery, but comparable to the laparoscopic procedure. The robotic procedure lasted 35 to 57 minutes, while the open surgery took 8 minutes. By all other measures, the robot's performance was comparable or better than the surgeon's.